Life revolves around rhythm. The rhythm of our steps, our breathing, our heart. But what if that rhythm is disturbed? What if the heart, the engine of life, goes out of sync? Atrial fibrillation and atrial flutter are the most common heart rhythm disorders. In Europe alone, these conditions disrupt more than 14 million lives, with almost 1 million new patients diagnosed each year. The prevalence of AF is projected to increase 22% by 2060 among people 65 years and older in the European Union. AF increases risk of stroke 5 times, depending on the presence of stroke risk factors and modifiers. We have a responsibility to patients to understand more about atrial fibrillation, to advance outcomes by learning from one another. Together, we can elevate knowledge, share experiences, and develop cutting-edge treatments for the growing number of patients in need. For 23 years, the AFib Symposium has enabled the EP community in shaping the future of AF treatment. Since 2002, it has brought together nearly 15,000 physicians and more than 900 faculty from around the world. Today, we continue this journey. We come together to share expert insights, to power collaboration, to restore the rhythm of life. Welcome to the 23rd Atrial Fibrillation Symposium. Let's shape the future together.